Bismillahirrahmanirrahim. Quote of the day. Beautiful people are not always good, but good people are always beautiful. I'm Dr. Muneeb Altaf, and today I'm going to critically appraise the article under the supervision of Professor Dr. Saira Afzal. The Prisma checklist will be used to critically appraise the article. First of all, starting from the title, the interventions for the neglected tropical diseases among children and adolescents, a meta-analysis. So, in this title, considering the Prisma checklist, uh, according to the checklist, the title should be a report as a meta-analysis or systematic review. So yes, in the title it is showing that it's a meta-analysis, it's written, and if there have been objective or targeted population, that will be an extra supportive information. So this title is good according to the checklist. Now comes to the abstract. The abstract, the strengths and weaknesses. The strengths of the abstract that it provide a structured summary. It has mentioned the objective data source, eligibility criteria, participant interventions, results and implication. All of these things has been mentioned in the abstract, while they have not discussed about the appraisal, study appraisal, synthesis method limitation, and conclusion of the this study is not that is not that uh, is not that good explained. So this is again the checklist of the Prisma, which is showing that what are the things which should be there in the abstract. So it should have eligibility criteria, objective background, and study appraisal. All these things comes to the introduction. So, in the section of introduction, strengths show that the author has beautifully explained the literature review or what we already know, and provide a rationale. And author has mentioned the aim. But considering the weakness, objective focusing on the PICOs is missing in the introduction, while it has been discussed in the methodology section. But according to the checklist, the objective the objective should be explained in the introduction area, considering the participants intervention, comparisons, outcome and study designs. Methods. So, strength of the methodology is the inclusion criteria has been provided, the information source, research strategy, considering the databases, registers, website data filters, and other sources has been explained. Two independent reviewers screen the titles and abstract of the studies. In duplicate studies that pass this stage had their full text reviewed by the two other reviewers, and any conflict are resolved by the third reviewer. So now again the strength stands for the list of the variables has been provided. Cochrane risk of bias tool, Cochrane effective practice and organization of care risk of bias criteria are the tools which are used to assess the risk of bias. Measures of outcome which are specified are the risk ratio and mean difference. Heterogeneity was assessed by I2 and X2 stats, and forest plot was used for the presentation. Two independent quality appraisal is done, and grading of a recommendation, assessment, development, and evaluation criteria is used to summarize the quality of evidence. So these was the strengths of the methodology section. Now coming to the weakness, there was no clear exclusion criteria was given in the methodology, even though it has been explained in the results section, but it is not that beautifully explained in the in the methodology section. Only listing but the definition of the outcome is not done. So only listing is of the outcome variables is done, but it has not been clearly defined. No other variables are listed and explained, and there is no description or process used to decide which study is eligible of each synthesis, which even has explained in the next section. Tabulation and the display of the results of individual study is also explained in the next section, and no discussion about the missing area in the methodology section. Sorry, missing data. So again, this is the Prisma checklist: eligibility criteria, source and search, study, data collection. So all of these things are present. These are only these two points which were missing that I have crossed them, and all of the rest of the points was almost available in the article. Now coming to the results. So strength are the number of studies screened, eligibility and inclusion in review with the reason for exclusion at each stage is beautifully explained with flow diagram. Characteristic for which data was extracted was mentioned with citation. Forest plot of summary data of each intervention group, effects and result of each analysis where the confidence interval is presented with supplementary data, and data presentation on the different bias of the study is shown in the figure 2. Results of the subgroup analysis is explained in the supplementary data. Now, the weakness of the results that there is no presentation of risk of bias of each study, which is required according to Prisma checklist, and citation of excluded study is not done. So this is again the checklist of the results section. Now, discussion and funding. So, strength is a summary of the strength and weaknesses of each main outcome is explained with the relevance of the key groups, and limitation is explained. General explanation in the context of future research is explained, and source of funding is mentioned. Again, this checklist of the discussion and some other information: registration information of the review and the review protocol, and the amendments of the provided registration. So all these things was not provided in the article, so that was crossed. Rest of the information was present. So that is all for today. Thank you.
Thank you, Dr. Muneeb. Um, it was a good presentation. But one thing I would tell you in the beginning would it be that if you would have added 4 or 5 slides of only the screenshots of the article, then and have highlighted the main points, adding 5 more minutes to your presentation, that would have cleared the things. Overall, you have mentioned most of the points. So, and most of the slides were also very clear, and they were in bullet points. So these are the plus points of your presentation. But for the next time, for everybody who is listening, please kindly add 4 or 5 slides of the article, only the screenshots with minor details, so that the other participants can understand what you are critically appraising. And I would like to add few more points and have a brief discussion on what are the points, what are the strengths, and there was a missing slide of way forward. I've already mentioned in the last previously that there should also be a slide for the way forward, and showing that how these results can be implicated in our settings. Are you listening, Dr. Muneeb? Am I audible?
Yes,
Yes, you
you
are
are.
audible.
Okay, okay. So, regarding the
Dr. Muneeb,
title,
kindly stop the recording.
okay. The title I think was not very clear regarding the intervention.